Well, hello everyone, and welcome to our education session on dementia, intimacy, and sexuality. My name is Ali Grady, and I'm an education coordinator here at the Alzheimer's Society of Peterborough, Kawartha Lakes, Northumberland, and Haliburton. And with me today are two other members of our education team, Sarah Cook and Chris Van Leuven. And we are excited to have this opportunity to collaborate on this presentation together. I do want to add a little bit of a disclaimer here that we are going to be talking about some sensitive topics today. If you feel uncomfortable or overwhelmed at any point, please feel free to leave the meeting or leave the room. You can turn it off. Whatever you need to do to feel comfortable and safe. You can also reach out to me or Chris or Sarah or your client support coordinator if you need to discuss this topic further or if anything comes up for you. Also, if there may be young ears, you may want to put in headphones. We are going to be talking fairly explicitly about sexual expression. So just a couple of disclaimers there. And lastly, we recognize that there may be some questions that come up and we want to make sure we have time to honor those. We're going to wait until the end of the presentation to answer any questions. So feel free to jot them down on a piece of paper, or if you want to type them in the chat, that's totally okay. Just know that we'll answer those at the end of the presentation. So let's take a look at what we're going to talk about today. So we're going to start by talking about some definitions. We're going to talk about what is intimacy, sexuality, and sexual expression. We're going to talk about how dementia affects intimacy and sexuality. Talk about the changing needs, both of the person living with dementia and their partner. Some strategies for responding to sexual behavior and expression, and also maintaining intimacy in a retirement home or long-term care setting. I just wanted to start out by saying that all of us, including people living with dementia, have needs and wishes for friendship, belonging, companionship, intimacy, and the expression of our sexuality. And we might fulfill this in different ways. It might be through marriage or partnerships, friendships. It all depends on our own unique situations and experiences. Now, it can be sometimes kind of confusing to hear the terms intimacy, sexuality, and sexual expression. Sometimes they're used interchangeably. So over the next few slides, I'm going to break down what each of these terms means. So let's start out with the term intimacy. People often confuse intimacy with sex, but it's much more than that. Intimacy is about trust, safety, acceptance of differences, emotional connection, and compassionate problem solving. It means knowing someone deeply and feeling deeply known. Intimacy is often present in close, loving relationships, such as marriages and friendships. It's important to note that there are different types of intimacy, including emotional intimacy. So, for example, sharing vulnerable feelings and emotions, intellectual intimacy. So, for example, being able to share ideas, even if you may not agree with one another, and sexual intimacy. So, for example, knowing how each other likes to be touched. Those are all different forms of intimacy. Now, sexuality refers to our needs and attitudes towards sexual activity and partnership. It's a very broad definition. It encompasses a lot of things. Sexuality is biological, so our bodily sensations, psychological, our emotions, our thoughts, and social and cultural. So what our society says and what we believe we need for touch and for emotional connection. It encompasses our values and beliefs, our bodies, our desires, relationships, gender expression, sexual orientation, and our thoughts and feelings about all of these things. We express our sexuality through thoughts, fantasies, desires, attitudes, values, and behaviors, and this can change throughout our lives. Lastly, let's talk a little bit about sexual expression. So, sexual expression refers to how we communicate at a sexual level. Sexual behaviors may include holding hands, grooming or self-presentation, sharing a bed, hugging and cuddling, erotica and pornography, masturbation, oral sex, and sexual intercourse. Our need to express ourselves sexually doesn't stop as we get older, and sexual expression contributes to our well-being as we age. That's why tenderness, warmth, emotion, passion, physical affection, and physical contact are important to the well-being of older adults. I just really want to emphasize that a healthy sexual expression at any age is an important and normal part of being human. So I'm going to pass it over to Chris to get us started. Now that we've kind of got those terms, the basics of those terms, to talk a little bit more about dementia and intimacy and sexuality.
Thanks, Ali, for that overview of those terms. I think that's really helpful. So, as we know, dementia causes changes in the brain that can affect cognitive abilities. It can also affect communication, personality, and behavior. For people living with dementia and their spouse or their romantic partner, these changes will have impacts on sexual and intimate aspects of their relationship. It's important for both people living with dementia and their partners to know how dementia may challenge and change the ways intimacy and sexuality are expressed within their relationships. To start, let's talk about the impacts of dementia. Dementia can have a significant impact on intimacy, sexuality, and relationships. Remember, at its core, dementia is a brain disorder. Brain changes are going to happen as a result of having dementia. The brain directs not only our cognitive and thinking abilities, but it also directs how we feel and how we act. So in other words, it controls our emotions and our behaviors. For example, dementia can cause a loss of judgment, a loss of social filters, changes in our inhibitions, memory loss, lack of reasoning abilities, and changes in communication. And with that in mind, it comes without surprise that dementia can change how a person expresses their wish for companionship and intimacy. So, due to changes in the brain, the person with dementia may express their desire for intimacy in what we might consider different or unusual ways. The person with dementia may become more open or interested in sexual activity, while alternatively, they may become less affectionate and show a decreased interest in intimacy. Sexual behavior may become more unpredictable and harder to understand as dementia progresses. It's important for caregivers to understand that these changes in sexual behavior are common, and that the person with dementia might not even be aware that their behavior has changed. Over the next slides, we're going to discuss some of the changes in intimate and sexual behavior that a person living with dementia and their spouse or romantic partner might notice. The first one is reduced sexual energy and interest. So, dementia can bring about complex and mixed emotions, which in turn can cause this decreased interest in sex and other intimate acts. A person with dementia might find that their sexual energy and interest are reduced, which could be due to depression or other changes in the brain that result in apathy or loss of initiative. If the person's sex drive is reduced due to a diagnosis of depression, it's common for sexual interest and desire to return when that depression has been treated. The next one we're going to talk about is disinhibition. So disinhibition or disinhibitioned behaviors tend to occur when a person with dementia does not follow those generally accepted social norms, and they might act in ways that are considered inappropriate or in ways that their partner might find unusual, unexpected, or maybe even distasteful. This is because the usual brain mechanisms that keep us from acting on our impulses may no longer be working. For example, a person with dementia screen is going funky.
All right, Chris, we can still see you and hear you.
Okay, I'm just gonna see if I can, there we go. Sorry. Sometimes my connection goes weird and my screen has this tendency to go very blurry, but I think I've got it back now. So I apologize for the disruption. So this disinhibition that happens, it's because the mechanisms in our brain that keep us from acting on our impulses might not be working anymore. So, for example, a person living with dementia, they might flirt with someone other than their spouse or romantic partner. And this can cause embarrassment for the partner, and it can also be confusing and distressing for the person with dementia, and they may not understand why they're being told that their behavior is inappropriate. Other examples of these disinhibition behaviors include things like speaking graphically about sex, removing clothing in front of others, and self-touching in public. The next change that we're going to talk about is increased sexual energy. So one common symptom of dementia is that memory loss, obviously, and it can have a significant impact on a person's behavior. It's important to recognize that with memory loss, the person with dementia may have forgotten that they've already engaged in sexual relations, and then they might be looking to engage again. In other words, the person's desire for sexual interaction can increase when their short-term memory is affected. Perseverative behavior is also common due to changes that occur in the brain as a result of dementia. For some persons with dementia, this need for sex can be constant and can be expressed in inappropriate places or directed towards non-consenting individuals. It has the potential to create conflict in the relationship or with others around them. Sometimes medication may be required and prescribed to reduce this intensity. We also need to be on the lookout for misinterpretation of behavior as sexual. So when we're caring for someone with dementia, we may inadvertently misinterpret a behavior that we've noticed as a sexual behavior. For example, a person might remove their pants in public as a means of indicating that they need to use the bathroom, but it may be viewed as others as a sexual behavior. You may notice somebody touching their genital area only to find out later that they were experiencing discomfort due to a urinary tract infection. These behaviors are actually an attempt to communicate when the person's words may be lost. It's really important to understand the needs of a person living with dementia to ensure that a medical issue isn't going unnoticed. Doing a thorough investigation of why the behavior is occurring is important if we're going to address the person's needs and respond in the most helpful way possible. I'm going to turn it over now to Sarah, who's going to talk about the importance of having open communication when it comes to sexuality and intimate relationships.
Thank you, Chris, for sharing with us those important changes and how, they may impact sexual behavior and intimacy. Sexuality and intimacy are complex human needs that often lead to both emotional and even moral reactions. And even though we may not be comfortable discussing our emotional and moral reactions to the topic of sexuality and intimacy, it really is important for the person with dementia and also their partner to discuss these issues early on as much as possible in order to address worries and expectations in an open manner. So by talking about these worries and expectations openly and through a respectful dialogue, partners who want to be intimate can continue to do so with mutual agreement, which is so important, and also with an understanding that how they express that intimacy may indeed change as the dementia continues to progress. Even with the progression of dementia, often it's not a matter of having to cease sexual activity, but it could be more about finding different ways of expressing that intimacy. So it is really important to recognize that every single relationship is unique. Each person chooses the other for different reasons. We also know that relationships can be straightforward, but they can also be really complex. And regardless of the type of relationship, it's important that both the person living with dementia and their partner find it satisfying. Just because one partner experiences the changes of dementia, it does not mean that their sexuality and intimacy needs cease to exist. In fact, when one person has dementia, couples are often able to continue to have a close, intimate relationship for many, many years. When changes do begin to affect the physical relationship, though, it's important to remember that every couple has their own way of managing these changes. And of course, what may work for one couple or one relationship may not necessarily work for another. It goes back to that unique relationship. Now, talking with a trusted healthcare provider or a client support coordinator at the Alzheimer's Society can really help partners to anticipate changes that may come as a result of the disease, and also to help consider strategies for addressing those changes. So that's key to note. Now, as I mentioned before, people with dementia can continue to have a healthy, intimate life with their partner for many years. However, dementia can change the way that people behave in their relationships. And Chris did talk about those different behavior changes. The changes in relationships and sexual needs of both the person living with dementia and their partner can certainly stir up some emotions in their relationship. So I thought we would take a moment to look at that emotional impact that can occur with these changing needs. So let's look at those. So in terms of emotions, the changes in relationships and sexual needs of both the person that's living with dementia and their partner can cause the different emotions that you see that are listed here on the screen. So let's talk about each of these a little bit further. So first of all, a big emotion can be the fear, right? A person may fear losing the intimacy, that comfort, the love that has always been important to them. And each partner may fear that the sexual or intimate relationship may be lost at some point, and they could be worrying that they may not be able to regain it. So that can be a source of fear. Confusion. Well, each partner may be confused about what's changing in the relationship, and of course, why it's changing. They may not know how to feel or how to respond in light of those changes. Anxiety is another common emotion. And, in terms of anxiety, they may worry about the future of their sexual or intimate relationship. And they may become quite anxious about the changes that may be unfolding and what that means for the future. Embarrassment, another common emotion. Each partner may experience embarrassment, again, due to some of the intimate or sexual changes that may occur in their relationship or in their sexual or intimate needs. And last that's listed here, but of course not an endless list of the different emotions, is the sadness. So each partner may experience sadness over the changing relationship. And again, the changing needs. They may grieve if there is a loss of intimacy in the relationship. And here's what we know. Some people can feel lonely and express their loneliness and that sense of isolation that they might be feeling in sexual ways. As I shared earlier, it's very important for the partners in an intimate relationship to talk openly and respectfully about their emotions and their feelings with each other so that both perspectives and experiences can be shared and acknowledged. So another important area to discuss in light of the changing needs of the person with dementia and their partner is meeting the needs for physical intimacy. As Chris shared with us a little earlier, dementia can have an effect on the person's interest in sex, which may conflict then with the partner's own needs. For example, people with dementia may engage in self-touching in public. They may make explicit sexual comments and use graphic or crude language around others, which then in turn could be difficult for the partner to cope with, and of course, to know how to address those behaviors. Partners may not know how to respond to unwanted sexual behaviors. They may feel uncertain about how to address this with a person, especially if they're worried about embarrassing or even upsetting their partner. Sometimes if the partner is in the position where they need to take on more of a caregiving role, physical intimacy may become less appealing to that partner. They may no longer have sexual feelings or the desire to continue a physically intimate relationship. And they may feel guilty if they no longer want to be physically intimate with the person with dementia. So have that added feeling of guilt. As the needs of the person with dementia and their partner change, some couples may discover different ways of sharing closeness and comfort and intimacy. The partner may experience grief over the loss of simple acts of intimacy, such as, sharing the day's events, talking about the day's events over dinner, having that close conversation. And this grief, while the person with dementia is still alive, is often referred to as ambiguous grief. So we often think about grief as when the person is gone, but grief can also exist in the relationship while the person is still here. An ambiguous loss in this particular instance can happen, and that's the term that we use, as ambiguous loss. An ambiguous loss can happen if the person is grieving the loss of that intimate or sexual relationship with the person, even though the person is still physically here. I'm going to turn it back to Ali.
Thanks, Sarah. Something that may come up both for the person living with dementia and for their care partner is the desire to seek companionship with a new partner. So we're going to talk about this first from kind of the perspective of the person living with dementia, and then we'll talk about from the perspective of the care partner as well. So for the person living with dementia, seeking out a new partner can happen when the person with dementia is meeting new people in a day program, or when they're living in a new environment like a retirement home or long-term care home. And this can be a very sensitive issue for all of those involved, but particularly for the partner. The partner, family, or even the care provider may try to prevent the person living with dementia from seeing their new companion and fulfilling their needs. However, barring the person living with dementia from seeing their new companion means that their needs for intimacy and closeness go unfulfilled. In turn, the person with dementia may express frustration, anger, sadness, or withdrawal, or seek out an additional new companion. So, as difficult as it may be to see the person with dementia enjoying the company of someone else, sometimes fostering a positive relationship with this new companion can be the best solution. In these situations, we need to support both the person living with dementia and their partner. If you are the partner in this scenario, know that you are not being replaced. It is the progression of the disease and the changes in the brain that are causing the person to seek out a new companion. It may be helpful to seek out counseling and ongoing support because adjusting to these changes in a relationship can be very emotional. And again, whether you start with reaching out to your client support worker client support coordinator here at the Alzheimer's Society, we can get you in touch with more intensive supports if you need it. For the partners of people living with dementia may also have needs for intimacy that are not being met by the person living with dementia. They may miss the intimacy, whether it's emotional intimacy, physical intimacy, intellectual, or sexual, that they shared with the person living with dementia, and they may seek to meet their needs outside of the relationship. Seeking intimacy from outside of this relationship can bring up a wide range of emotions, including but not limited to guilt, grief, joy, fulfillment, and sadness. It can sometimes be hard for family and friends to understand, and they may not support the decision of the partner to seek out a new companion, and you may find yourself feeling alone and without support. Healthcare providers can be helpful to support partners to reflect on their feelings and how to balance the needs of the person living with dementia with their own needs. And again, if this is something that you're experiencing, please reach out and we can have a further conversation. A couple of points that we wanted to emphasize for partners or care partners, romantic partners to understand. It's important for partners to understand that having dementia does not mean that a person will no longer have any interest in physical intimacy. As humans, we all have a desire for connection, companionship, and intimacy, and that doesn't change with the diagnosis of dementia. The second important point to consider is that having dementia does not mean that your needs need to be met in the same way as before. As we've already talked about, as the dementia progresses and symptoms like memory loss increase, the person with dementia may no longer be able to recognize their partner, and that may be another reason why they might explore a relationship with someone else. As we've also mentioned, the person with dementia may behave in ways that their partner finds unusual, which can cause the partner to feel uncomfortable. So it's okay to change the way in which you are being intimate with each other. Maybe it's just holding hands, maybe it's cuddling. It doesn't necessarily have to look like what it used to look like.
So now that we've built up our understanding of the different reasons why a person living with dementia might be experiencing behavior changes related to sexuality and intimacy, we're going to talk about the ways care partners can effectively respond to these behavior changes. So if the person with dementia's sexual energy is expressed in ways or places that aren't really socially acceptable, or they're directed towards non-consenting people, strategies may be adopted to address their needs in more appropriate ways. Our first little piece of advice is to not judge, scold, or tell the person that they're being inappropriate. People with dementia may express their desire for intimacy in different ways than they used to due to changes in their brain. And this doesn't mean that the expression is inappropriate. It's important that others understand the meaning behind the behaviors and provide clear and compassionate feedback when the behavior seems out of place. We also recommend that you try your best to provide reassurance and understanding. Recognize that a person's need for affection doesn't change with the diagnosis of dementia. So we're going to validate the person's feelings and acknowledge that their needs for physical connection and intimacy are completely normal. And be sure to look for unrelated needs. Do they need to use the toilet? Are they lonely or bored? Are they too hot or too cold? What needs are they trying to communicate? Try to look for that hidden logic if the person's behaviors or their choices appear illogical on the surface. We're also going to try behavioral approaches to redirect those sexual expressions and that sexual tension to activities that are going to help the person focus on something else. An example of this might be to invite them to join a physical exercise class or program. Try your best to stay calm and not to overreact to the situation. By approaching these types of situations in a calm manner, you can avoid drawing any negative attention, which could embarrass the person in the moment. And lastly, try to provide privacy for sexual expression. Ask the person if they would like some time alone in their bedroom. Some situations might require management with medications, but this is typically considered as a last resort. If medications are used, they should be reevaluated regularly. You know what? I'm stumbling over my words today. It's like it's a Monday, but it's a Tuesday. Also, it's really important that we remember that for a person living with dementia, it's not that their behavior suddenly becomes inappropriate. It's that memories and boundaries kind of become blurred within their minds. I'm now going to turn it over to Sarah, and she's going to discuss those unique circumstances that can arise when a person lives in long-term care.
Thank you, Chris, and thanks for sharing those really helpful strategies with all of us. So as Chris shared, the topic of intimacy in long-term care is really another area that we wanted to briefly explore in our time together today. Careful consideration really needs to be given to supporting the person with dementia and also their partner in maintaining their intimacy while the person with dementia does live in a long-term care setting. So, in order to maintain that intimacy with a partner who is living in a long-term care or even a retirement environment, you may wish to ask for several things to kind of support that. So, asking for privacy for sexual expression, because everyone deserves the right to privacy for their sexual needs. So that's really, really key. It's okay to ask for that privacy and to remind staff sometimes that privacy is needed. You can also ask if there are any options for overnight private accommodations for couples that do wish to be alone together. I know this may be difficult currently due to restrictions from the pandemic. We hope, that as things continue to improve in our COVID climate, that we may be able to return to options like this in the future. But again, it's always helpful to ask these questions of the long-term care retirement home staff so they can come up with some strategies to best support you and your needs. So, I know sometimes it's uncomfortable to have that conversation, but they really are there to help support you and the person. So do have those important conversations. And another key idea to maintaining that intimacy when a person is living in an alternate environment like long-term care or retirement is to encourage a variety of different ways to meet, the intimacy needs of the person. So it could be a warm hug. It could be holding hands or giving a little hand massage. It could be dancing together. Maybe it's listening to music or singing together, sitting close and having that connection. Those are all excellent strategies for helping the person to feel comforted and loved. And this is certainly not an endless list. So with you and your and your partner's needs in mind, think of all the different ways that you can help to convey and share that intimacy and love. Talk about what works for you in your relationship. This is a really important statement that summarizes so much of what we've talked about in our time together today. Dementia does not change a person's need for love and affection but it does change a relationship. And it's important to acknowledge and recognize the changes that can happen in a relationship, but to never lose sight of the fact that people with dementia, regardless of the changes that they're experiencing, they still have a need for love and affection. And helping to fulfill that need for love and affection is another key component of helping them to live well with dementia. We've talked about a great deal in our time together today. I know that's been a lot of information. If at any time, and I know both Chris and Ali have said this, but if at any time you have questions or you would like further information or support or even other resources to support you, please do not hesitate to reach out to us, to one of us, but also to your client support coordinator at the Alzheimer's Society, because it's our job to help to support you and assist you with those resources. Also, seeking the advice and support of a trusted friend, a family member, maybe a counselor or a healthcare professional can also be helpful options that you may wish to consider as well. So we wanted to leave you with what we hope are some helpful resources on dementia, intimacy, and sexuality. And we first wanted to mention a brand new e-learning opportunity that was just released quite recently, I think honestly within the last couple of weeks. So a group that's called the Behavioral Supports Ontario Sexual Expression and Dementia Working Group. That's a mouthful. They were responsible for releasing their first e-module called Dementia and Sexuality, an Introduction. And this free e-module was developed with the support of a group called the Regional Geriatric Program Central. And it's available on the Geriatric Essentials website, which presents learners with an array of e-modules about a whole host of topics, including changes in cognition and depression, and of course, this new dementia and sexuality module. And you can see that the website, if you're interested, is listed here on the slide. And Dementia and Sexuality, an Introduction, it's really innovative because it uses a case-based approach that has the goal of inviting learners to understand how people living with dementia may express their unmet needs, including those that do pertain to sexuality and intimacy. And since myths and stereotypes about sexuality and dementia are so firmly established, so much so that they really do shape our interactions, they are explored in the e-module along with some practical strategies to support people that are living with dementia and across various settings as well. So it's helpful for a wide range of audiences. And within each case study, you get to learn about how dementia can impact the ways in which people that are living with the disease, how they communicate those unmet needs, including those that do relate to sexuality. So I just want to let you know that I had the opportunity to go through this e-learning module, and I found it extremely helpful. There's lots of different scenarios. You really get a good sense of the different challenges that the people are facing in those scenarios, and you get to look at some of the best approaches for addressing the particular behavior and changes that are happening. So I really strongly recommend it. Again, it's a wonderful resource because it is free and you can take your time at it as well. So highly recommended. The second resource that's listed here is a helpful summary of the information that we've shared with you today in this presentation. And it's created by the Alzheimer's Society of Canada, and it's called Conversations About Dementia, Intimacy, and Sexuality. And this information sheet really does talk about how dementia can affect a person's sexual behavior and their desire for intimacy. It provides many of the helpful strategies that we did discuss in our time together today, including, how to help people living with dementia, their caregivers, and healthcare providers to have those supportive conversations about intimacy and sexuality. So this information sheet, we listed the electronic, it's available electronically and in hard copy. We've listed the link there, but you can always reach out to us at the office because we can put you in touch with a hard copy as well, if that's preferred. So on behalf of Chris and Ali and myself, I want to thank you so much for taking the time to be with us today. We do hope that the information and the resources that we have provided here will be helpful to you. And I think at this time, we'll stop the recording and address any of the questions that you might have. Just give me a moment to stop.